Thank you for using our COVID-19 testing site today. This video will provide you with everything you need to know about the process. A link to our intake form was texted to you. Please complete this before leaving the parking lot today. This will help to expedite the process. We will also email you a link to activate your patient portal, which will give you permanent access to your results after speaking with a provider. Please check your email today and follow the instructions to verify your information. For rapid antigen test results, an A-pattern provider will call on the same day with your results and next steps. A positive antigen test result is considered accurate, but there is about a 12% chance of false negative results. Since it is possible for the rapid test to miss some cases, we collect a second specimen to send to an independent third-party lab for processing the PCR test. On average, PCR test results are typically available in 3 to 4 days, but may take longer due to the current surge in COVID-19. We'll give you a call as soon as we get these results back. If you are testing today because you are experiencing symptoms, you should isolate until you receive results. An A-pattern provider will make further recommendations during their follow-up call. If you are testing because you had contact with someone who tested positive, whether or not the person was symptomatic, the CDC and the Tennessee Department of Health recommendation is to quarantine for 14 days after your last exposure to the virus. This is because it can take up to 14 days to develop symptoms. Even if today's test results are negative, that does not rule out a possible infection. By self-quarantining for 14 days, you lower the risk of possibly exposing others to COVID-19. You may return to regular activities earlier than 14 days in some situations, and this is explained on the Tennessee Department of Health handout that we sent a link to. If you're testing because you had contact with someone who tested positive, but you yourself have had COVID-19 within the previous 3 months and recovered and remain without symptoms, then you do not need to quarantine. If you tested today for travel, work, or school requirement, and you have no symptoms at all and no known contact with someone with COVID-19, then no quarantine is necessary. The most important thing that you can do to protect your health and prevent getting COVID-19 is to keep your immune system strong. Be sure to check out the link to the A-pattern handout for our recommendations. You can also help to prevent the spread of COVID-19 and end this pandemic sooner by wearing a mask over your nose and mouth and keeping a safe distance when around people who do not live with you. Avoid crowds and poorly ventilated areas. Wash your hands often and be alert for any new symptoms. If you have any questions, please do not hesitate to contact our clinic at 423-455-2711.